Live inoxidative stress blood analysis consists with 3 blood tests with 10 different live readings. Upon these 3 tests, we can detect more than 45 imbalances in your body, like kidney stress, liver stress, poor blood circulation in the heart, mineral deficiency, hormone imbalances, prostate issues, ovarian issues, immune system, parasites, lungs, leaky gut, digestive issues, virus, high blood pressure, thrombosis, high cholesterol, triglycerides, not losing weight, and much more. The patient reads all the tests alive on a monitor screen, while the blood is still alive, and another test with 8 different readings of the coagulated blood, allowing the patient to see what is going on inside of its body within these 3 tests. The procedure is like a glucose test, just a pinprick on a finger collecting 10 samples of the blood from the same pinprick. One sample of the blood will be placed on a sliding under the microscope for the live blood analysis, and all of the image it is transferred to the screen monitor for the patient to watch live. Another 8 samples of blood collected from the same pinprick will be drying on a different sliding for 25 minutes, and all the images transferred to the screen for live watch. The patient will have instant results, and also the patient will have 2 personalized protocols. One is nutritional, and another one is a supplements that will be recommended according to the results of the live and dry blood analysis. I am Andrea Souza, health coach, certified in live and dry blood analysis, located in Deerfield Beach, Florida. Telephone number 954-290-3792. Call in for your live and dry blood analysis and enjoy the travel inside of your body.
Okay, that was awesome, Andrea. Why don't you fill us in on the details there?
Yeah, okay. Hello, everybody. Happy Friday. My name is Andrea Souza, and I'm going to tell you a little bit of my background and why I love to do what I do today. About 9 years ago, my father was detected with liver cancer, and he was 80 years old, and he was also a diabetic, type 2 diabetes, taking 3 insulins per day. So he was detected with the liver cancer. He started the procedure, the conventional procedure, which is a chemotherapy, and he did it for 6 months, and he got no results. So he lives in Brazil, and I'm here in Florida. So I flew over to Brazil, and I had a conversation with my father, and I said, Daddy, would you like to try a natural treatment to see if we can get rid of the cancer? It will be nutritional treatment, lifestyle, and supplementation, and he agrees with us. So me and my whole family, we start a new nutrition for him. It was not easy because 80 years old man has a very acidic body. So we need to alkaline his body. We need to take all the sugars and carbs away. It was a very hardest diet, but within 6 months, my father had a remission of the cancer, 100% remission. No more insulin for the diabetes. That was a very successful nutrition that me and my family put together. I have been studying nutrition for almost 25 years. So when that happens and my father got cured from cancer and diabetes, I thought that I need to take it serious. And I went to school, I got my nutrition license. And as a nutritionist, I was doing a weight loss program. And I noticed that everybody's so different, and I need to personalize individually every program to lose weight. But not only that, I thought that I need to see inside the person's body to see what's going on. Many times they have a different symptom, but and I could not figure out what was going on. So I decided to go get my license for life and dry blood analysis, and I will explain a little bit more about the procedure here at my office. First of all, it is a chronic disease prevention. I detect imbalances early so we can treat, so the person won't become ill or have a cancer or have any other disease like chronic immune disease or you name it. So I noticed that to treat a person starts with the emotion. The emotional stress, anxiety, it really messed up with a person. And I thought that the treatment has to be the emotional, and then the soul, the body, and the spirit. This is all a combo that matters. So saying that, what I do is exactly, I'm gonna try to explain it here. Let me get this. I pinprick the finger like it shows on the video, and I put a little stamp of blood on the sliding. That sliding goes under the microscope, and I transfer the image to the computer. As you can see here, let me see if I can get this. All right. So we have several different, this is the live blood analysis, which is the first test on the bright field. This is, of course, this is one of my patients that I have. I just put an example of the pictures here so you can see. This is your red blood cells. This is your white blood cells that shows better on the dark field. White blood cells, immune system, your defense immune system. This is my second test with the blood still alive. I go to the dark field and I see all the imbalances in there. A person that has inflammatory bowel disease, a very ugly picture, right? This is the level of oxidative stress. This person here has cancer, almost no blood in the system. Where is the white spot? There is no blood. This is a person with IBS, irritable bowel syndrome. So this is just a few examples. I transfer the images to the computer, and then on my wall, I have a chart that explains everything that shows on the monitor. Will be showing, I bring the patient to confirm the reading right here. So I can see more than 100 imbalances in the body. Like for example, if the person is not digesting the food properly, the red blood cells will be all stick together. If the person are intoxicated or dehydrated, that's the picture that will appear on the screen. If the person has a kidney stress, that's the picture. If the person has B12 deficiency, one cell is bigger than the other one. Stress on the liver will show me a target cell. Hormone imbalances, poor blood circulation in the heart, level of inflammation, stress, the white blood cells, the immune system, we're gonna see if it's active or inactive. Inflammation in the body, fatty liver, high cholesterol, triglycerides, candidias, which is a fungus, crystals, cholesterol crystals, uric acid crystals, proloplast crystals, all the bacteria here. This is the live blood analysis. The blood is still live and I'm reading, and I do those 2 tests. Then another set of sample of blood will be drawing so we can see the rest of the body. And what I can see the rest of the body is oxidative stress. I can see any problem on a prostate, uterus, the gut, inflammation in the gut, intoxication in the gut, leaky gut, adrenal stress, IBS, irritable bowel syndrome, lymphatic congestion, thyroid, heavy metals, poor circulation and poor blood circulation in the heart, lung, virus, deficiency of minerals, parasites in the liver, arthritis, and so on. So that was hard. As you can see, I can detect many imbalances in the body, and the patient got to read its own blood, go inside of your own body and read with me and see and get the impact. When we see on a screen monitor what's going on inside your body, a patient wants to change the lifestyle. It's not just a simple diet. I cannot give out the same diet to a person that has IBS, for example, and the person that does not have IBS. A person that has a leaky gut is different from IBS. So the diet is different. So in order for me to put together a diet, a nutrition for a patient, it's completely different from another patient. A patient that is full of parasites, for example, has no energy, has no food absorption, is not absorbing nutrition at all. So we need to clear the parasites. Some people have parasites in the liver. Some people have parasites in the gut. So I can see all of that. Some people have poor blood circulation in the heart, and I need to be careful with that because according to the condition of the patient, I need to decide what diet, what nutrition that person can be taking. Not only the food, but the stress. The stress is something really serious here in my office. A person with anxiety, stress, panic syndrome, that person needs to be treated here first and has to be treated the gut. Usually this person has a leaky gut for sure, because the stress gets to stress on the liver, stress on the kidney, you get to a leaky gut. What is a leaky gut? Leaky gut, it's a hole on the wall of your intestine, and food that's supposed to be wasted goes into your intestine now and stays there, inflamed, intoxicating, irritating. So leaky gut, it's a hole on the line of the intestine, in a wall line. So what I like about my blood work is that I can see everything that is going on inside of a person. According to what I see, I'll put together a nutrition protocol. Not only that, we need the supplementation according to the reading. So it's not the same for every patient. If a person has a very low immune system, I need to focus on the immune system. If the person has a leaky gut, we all know that 90% of diseases come from the gut. So I fix the gut, the person becomes happy, less anxiety, no more stress. It's unbelievable. So it's according to the reading. My blood work shows more than 100 imbalances inside of the body. So now, with all the results that I see, all the tests that I do, I can treat the patient. Usually, I send them to a therapy. I'm not a therapist, but I like sometimes to work with the therapist along with my treatment So we are going to be treating from inside out. We're going to be treating the stress, the anxiety with some therapy and my protocol. And I work along with some other professionals too. So I don't know if I could explain, Michael. I'm nervous. I am very nervous, and this is I don't know, I'm not used to do live, but I hope that you understand a little bit. That's why I showed the video. Mm-hmm. So it would help me explain. Now, if you have any questions, I'm ready, Michael.
Yeah, absolutely. Let's turn it over to questions. First of all, you did awesome. I think you took a very complex topic and broke it down very simply, and all those visuals in the videos were excellent. And one thing I would add, Andrea showed me an actual patient's results, and I think it was a 17-year-old boy. And my question is like, all right, how do you get them to really want to make the change? And like she says, you just show them, this is what's going on inside of you. This is what the malfunction, what it looks like in your body. And that was motivation enough, even for, I believe it was a 17-year-old boy. That really struck me. But I don't know if you want to add to that or just take questions. I'm sure there's plenty of questions. But I'll leave
Michael, yeah, usually when I have a teenager here or a child, they always come with their parents, one of the parents. So I think who's going to be taking care of that teenager or the child is the mom or the daddy. So I'll bring most of the responsibility to the parents, but the child and the teenager are also going to be having the impact, the visual impact on the screen. So, they go home, they have nightmares and stuff like that. And they really want to change their lifestyle because they get impressed.
I have a question, Michael.
Go ahead.
What do you work with other medical professionals outside your clinic?
No, here at my clinic, I have an osteopathic doctor, I have a physical therapist, and I have a therapist. I have all here in the clinic. But I'm open, of course, to not necessarily I have to work with my people here, but I'm open. Sometimes my patient lives so far away, I need to find someone close to them.
And what would be like a range in costs? Because each patient is different. What would be a range in the expense of something like this?
Are you talking about my test?
Your services, yeah. Your test.
Yeah, my service. Yes, my service. It's right now I have a promotion because of the COVID-19. I lowered the price so it would be accessible for everybody. The patient stays with me for 1 hour and a half, 1 hour and 30 minutes. And the cost right now is $155, $155.
Wow, that's good.
The regular price is $230. I lower, so people now at this situation, it's a lot of people not working or working part-time only. So I lower the price so it would be accessible to everybody.
Okay. So that's the analysis and the treatment, or treatment is separate?
I do no. Yes, the patient walks out of my office with two protocols. One is a nutritional, another one is a supplement. I do follow up on the WhatsApp, no charge. I do a follow up for 2 weeks at no charge. So patient can ask me questions as much as they need to on the WhatsApp, and I will be following up with them for 2 weeks. Now, within 3 months, depending on the case, I have cancer people now that they need to come back for the test every 2 months. But if the person is reasonable, healthy, 3 or 4 months, I will ask for the return.
Andrea, does the person have to be in the office physically? Is that essential to this, or can the samples be mailed in?
Oh, no, Michael, good question. I can prick the finger, and I'm going to take that sample of blood put under the microscope. I have 20 minutes to read that blood while it's still alive. After 20 minutes, the blood will be dead.
Right.
Now, another set of blood will be drying. The dry blood, it stays longer, because it's dry. It's a dead blood.
Mm-hmm.
But the live blood analysis, it's a fresh blood, and I have only 20 minutes to read that.
Right. Hence the name, live blood, right? Live
and coagulated,
mm-hmm.
right? Blood analysis.
So I have a question.
Okay.
Or more, I guess, a comment to add here. I see because there's so many health workers here, people that wellness even. I see a lot of synergy that you could have with a lot of these people to catch things early, that your common tests that doctors prescribe, most of the time they're looking for an ailment of sorts. This is more, you're trying to catch whether it's malnourishment or something, kind of a wellness, right? So, so that's the thing. I think that there's a powerful synergy here for those in this profession.
Yes, Nathan, thank you for your comment. One example, I have a patient and she was extremely cramped on the lower belly, and she has extremely diarrhea. So she went to the doctor. Doctor gave her antibiotics. She was on antibiotics for almost a month. And then she heard about my test. She came here. And her problem was that she did not need antibiotics. What she needed was, she has IBS up to the roof, irritable bowel syndrome, right? So irritable bowel syndrome, when the person already has the symptoms, it's because it's really aggravated. So she got better within 4 weeks, completely better, just with the nutrition supplementation. My treatment is 100% natural. So it's not a magical pill. It takes a while, but I want to go to the root of the cause and bring it up. I want to see the root of the cause, which the doctor cannot see the root unless if he's going to do, even if he's going to do a regular blood work, it's hard to see. Unless if you go deeper on the deeper, like endoscopy or screening. But here I can see the cause. I had a patient, for example, that was full of parasites. That person was not absorbing nutrients. He was so weak, so skinny, no energy at all. She was full of parasites in the gut. And the problem is the parasites can go to the brain if I don't treat fast enough. So that's some of the examples. We need the doctor, conventional doctor. Yes, we do. We need antibiotics. Yes, we do on emergency cases. But here, if it's not an emergency, we can treat naturally, which I think is a good option.
Hey, thank you very much, Andrea. I have to go. I know Jeff had put a very great question in the chat, but thank you. I do have another appointment. Thank you to everybody. I appreciate you guys.
Thank you, Nathan.
I have a question. Can I ask a question, Michael? You tell me.
Yep, go ahead.
Okay. Andrea, my mom, they found an elevated enzyme, and this is very specific, but in the blood, it's alkaline phosphatase. Have you heard of that? Do you know what that is? Okay. Is there something you can do about this, or because she had a CAT scan yesterday, nothing showed up, and she has a severe pain. So do you think you can help with this? I mean, what would the protocol? I have no clue.
I cannot give you, I cannot guess, first of all.
Okay. Yeah.
I have to read the blood, and yes, I can see the elevated enzymes in the liver, which was the most of the case here at the office today, fatty liver, and I can see the whole body, but I cannot guess. My protocol is according to what I see, and then I take a note and I put a protocol together. Yes, I can help.
Okay.
And you know,
Obrigada.
and she can,
Yeah.
Muito obrigada.
Thank you, guys. And I know we're running over time now, so I just want to encourage everyone to connect one-on-one with Andrea, and let's take it offline there. But one last quick question is, Andrea, is this covered under HSA plans? Do you know, like a health savings account would be covered there?
Unfortunately, holistic approach does not accept insurance, or the other way around. Industrial, pharmaceutical, and insurance do not recognize holistic approach.